Good afternoon, folks. We'll go ahead and get settled in here as we go on to the last speaker of the day. What a great group of speakers. We are very fortunate to have put this together for New Mexicans, especially professionals in the behavioral health industry. Again, RioGrandeATP.org and HUVA will be putting this video posting. So help get the word out to others who missed it. It'll be on HUVA for 3 months. And then also RioGrandeATP.org YouTube page. Actually, it's Rio Grande ATP, the YouTube page. Any comments, Amanda, that you'd like to make while people are getting settled in here?
No, I don't think so. Just the presentations have been excellent. I mean, I thought I knew about all there was to know, and I've learned quite a bit of new information. I think, I had put in the comments, being someone who works in the public schools, the importance of educating our clients as well on keeping their marijuana locked up and making sure that children don't get it. At my school alone last year, we had several 9 and 10-year-old children that had gotten their parents' marijuana vapes and brought them to school. And so I think there's just been a really lack of public health information put out, educating people about, how this can affect children, how, especially with edibles, even with adults, the amount of, presentations we have in emergency rooms. And so I think us as providers are really on the front line to provide that public health education to our clients who are using marijuana.
Excellent, thank you. And again, I'm going to sound like a broken record. I ask, not respectfully for your vote. We know tomorrow's the big day for voting, but I ask for you to reach out to your legislators about the law of when they legalize cannabis, and where does it state that there's money for treatment for cannabis use disorder and education. And if you agree with me, raise your hand here now that we need to talk to our legislators and get ahead of this cannabis use disorder. Like alcohol, we don't need to demonize alcohol or cannabis, but there is that percentage, as was presented, that people that have addiction. So we just ask that you reach out, and so that we continue to provide, looking at cannabis use disorder treatment for good interventions, and also break that cycle of young people. The epidemiology report that I know our next speaker comes in, when you look at the young people using marijuana, it's a problem, all the way down to depression and attempted suicide. I know San Miguel County, I presented there a while back, and #1 for suicide attempts for young people. So, we're just wanting again to look at funding for cannabis use disorder treatment and also education, as mentioned. All righty, thank you for raising your hands and, get the word out. So we're moving on to get started. I think, Mr. Josh, we're ready to rock and roll, right?
You are.
All right, thank you, sir. Well, it is a privilege to introduce our next speaker, Dr. Dominick Zurlo. Dominick is currently the Medical Cannabis Program Division Director for the New Mexico Department of Health, and has worked in substance use, infectious disease, and education for over 30 years. He began his work in the field of substance use at the University of New Mexico's Center on Alcoholism, Substance Abuse, and Addiction, and continues working with several different community organizations focusing on helping marginalized populations. This has included work with people experiencing homelessness, substance use issues, and efforts to reduce infectious disease transmission. In addition, Dominick has been involved in national policy advocacy initiatives for improving the lives of individuals who inject and working towards increasing overdose prevention efforts. He begins working at the he began working at the New Mexico Department of Health in 2008, and since then, he has been instrumental in expanding the availability of hepatitis prevention efforts, syringe services, overdose prevention, and education with Narcan distribution, medical cannabis. More recently, he worked to include COVID-19 response efforts and leading efforts related to the changing landscape of cannabis here in our beautiful state of New Mexico. Please help me welcome Dr. Dominick Zurlo.
Thank you, Lawrence. I appreciate the introduction and good afternoon to everybody. I'd like to, first of all, of course, thank the sponsors for this event for inviting me and having me here. This morning was a very interesting set of speakers, and I hope that I'm going to be able to add to some of what they have been saying and to be able to explain some aspects of the program, especially some of the things that actually are happening right now, but many people may not recognize are occurring. And as Lawrence mentioned, I'm the director for the Medical Cannabis Program Division, and this is actually a program that is very near and dear to my heart for many reasons, because I have seen the medical benefits of cannabis for many patients. And while the research is indeed very contradictory sometimes and isn't very good, we're going to talk a little bit about how that can be improved and some of the additional needs that we have to have, especially here in New Mexico, to be able to have a strong program and to be able to respond to what the residents and the patients here in New Mexico need. Before I get started on the rest of the presentation, I of course want to make sure that we have our acknowledgement on behalf of all of my colleagues here at Department of Health. We acknowledge that we are on the unceded ancestral lands of the original peoples of the Apache, Navajo, and Pueblo, both past and present. And so with a lot of gratitude, we pay our respects to the people, to the land, to these communities that have and continue to shape and contribute to what is today known as the state of New Mexico. One of the things that is always important whenever we're talking from a perspective of the Department of Health is we want to ensure that the programs that we are advocating and the programs that we are managing meet multiple goals and missions within the state. We want to ensure health equity, and we work with our partners to promote health and well-being and improve health outcomes for all people in New Mexico. This includes expanding equitable access to services. We want to ensure safety in New Mexico healthcare environments, improve the health status for all New Mexicans. And one of the most important ways of doing this is by supporting each other, by promoting an environment of mutual respect, trust, and open communication. We need to ensure that the resources are there for staff and for our community partners to be able to serve New Mexicans, to be able to grow and reach not only our professional goals, but also to reach the communities and the people within those communities. So it's been mentioned a little bit before about the beginnings of the program, and I'm really just going to focus on a couple of aspects of the history of medical cannabis here in New Mexico, specifically the Lynn and Aaron Compassionate Use Act. When the Lynn and Aaron Compassionate Use Act was passed, cannabis use was illegal throughout most of the United States, and it still is illegal on a federal basis, but is legal in a majority of the states within the US at this point in time. But the Lynn and Aaron Compassionate Use Act, we can't look at it just as the act itself. We also have to look at how this came about, what happened to cause it, and where it has continued to move us in today's atmosphere, including healthcare, judicial, politics, and in many other areas within our communities. One of the big things that people tend to miss when they're talking about the Lynn and Aaron Compassionate Use Act is this is for the beneficial use of medical cannabis in a regulated system for alleviating symptoms. And I want to emphasize that this is for alleviating symptoms. Nobody who is within the program is stating that this is a cure, that this is something that is going to magically make a medical condition go away for an individual. Medical cannabis is to help alleviate symptoms caused by a debilitating medical condition. And that is the main purpose of the program. So the role of the medical cannabis is to try to help and ensure that there is safe use, possession, and administration of medical cannabis in New Mexico. Now, this includes both patients and their caregivers. And I'll talk a little bit more about caregivers in just a few slides. But the main purpose of the program at this time is to review, verify, and issue patient registry cards for those qualified patients. Now, I know it was mentioned during one presentation this morning about the dispensaries issuing the cards. Dispensaries do not issue the cards for the qualified patients. That is only done through the medical cannabis program. So we also work with medical providers to help educate about medical cannabis. And we're going to talk a little bit about some of the issues and concerns around that as well. And we work with the Medical Cannabis Advisory Board, who has the authority to recommend additional qualifying conditions to the Secretary of Health for potential inclusion in the list of qualifying conditions. We also work with the Public Health and Safety Advisory Committee, which is a new committee just formed this last year since the passage of the Cannabis Regulation Act, which was the act that actually legalized adult use sales for cannabis. And through this particular committee, we are looking at monitoring the health effects of the legalization of cannabis and how that is affecting individuals, how that's affecting patients, and how that's affecting other community members who are using cannabis. So here is a list of the 28 qualifying conditions. And again, I know another speaker had put them up, but here you can have them not only alphabetically, but all on one slide. So you don't have to flip through a couple of slides to be able to see them. And it's very important to note that when the program since the program has been in existence for over 15 years at this point, we have really gotten to that point with regard to qualifying conditions where the vast majority of individuals who are enrolling under 3 conditions. And I'm going to show you those in just a few moments. So the program overall has just over 123,000 individuals in it as of the end of September. We are currently working on the October numbers and data, so we should have that released soon. Now, one thing that I am going to point out and I am going to show is from 5 years ago, in 2018, there were just under 60,000 patients enrolled in the program. We actually reached a peak of over 130,000 patients in the program a few months ago. That is starting to decline slightly, and that's in part due to adult use. So we currently have the 124,000 patients in the program at the end of September. And as you can see, in April, we had 135,000. Now, we anticipated this reduction after adult use legalization occurred and the sales for adult use started, which started, by the way, on April 1st of 2022. Now, the reason that we expected this is because we've seen this in other states that had medical cannabis programs and then enacted adult use or commercial sales. And what we anticipate happening is that our numbers of patients who are enrolled will continue to decline for a while, and then it will level out, and then it will start to increase some. Now, part of this is because since cannabis is available through other means and not just through the medical program, there are some people who only occasionally use cannabis for whatever reasons they are using it, who will say it's not worth it to me to go and see my doctor in order to purchase that 1 or 2 times a year that I purchase cannabis, which if I was going to do it legally previously, I had to be enrolled in the program. So we have some individuals who will actually not enroll for that reason. We also have many individuals who, because our card is a 3-year card, and that only changed a few years back. But because the card doesn't expire for 3 years, we have many people who are just now hitting that expiration date. And now I'd like to ask all of you, how many of you, when you look at your driver's license, you suddenly realize right before it expires that it's expiring in a month, or that it just expired last month, or you only find out when you go and purchase something and they say, oh, by the way, your ID is expired, right? That happens on a fairly regular basis. Well, the same thing is happening with many of our medical cannabis patients. And because this was a change from a 1-year card previously to a 3-year card, our patients who have that 3-year card, that first group of patients who received it, are just now having it expire. And so they're not realizing it's expired. And unfortunately, we get those phone calls in the office saying, my card just expired and I need to make my medical purchase. Can you help me on that? They still have to go through the process of getting a recommendation from a licensed practitioner. And so that sometimes, unfortunately, can delay them. So we recommend, especially for providers, to make sure and remind patients to take a look at that card. Now, we are doing a few things that will help that in the future, and I'll talk about those again in a little bit. Now, as I mentioned, we do see reductions in other states where this has happened. In Colorado, for example, their peak enrollment back in 2014, prior to adult use sales, was just under 100 or just over 117,000 patients. And their current enrollment is about 74,000 patients. Now, that had dropped actually much lower and then began to rise up. And so we anticipate seeing a similar pattern. Arizona experienced the same issue, except they're still in a state of flux with regard to their patient enrollment. So a little bit more time will be able to let us know what is going to happen with regard to their enrollment. And so far, it seems as though they're following a similar pattern to Colorado and also several other states. And I bring up these two states because they are states that actually border on New Mexico. So this is not anything different than what we have been seeing within our region. And actually, at this point, let me just ask, are there any questions so far? Nope. Okay, I will continue on with some more of our wonderful pieces of data. So the next part I wanted to bring up is our age ranges. Now, with the advent of adult use, the Cannabis Regulation Act last year, what we have seen is that our age range within the medical program has not changed at this point. We are seeing it stable as far as percentage from last year to this year. And we don't really anticipate that changing very much. There may be slight shifts, but that's really going to be more about population and age differences among the general population here in the state. One thing that I really want to point out on this is there are really very few individuals, relatively speaking, who are enrolled in the medical cannabis program who are under the age of 21. Now, I say that because this is the one age group where we do anticipate over time seeing an increase. And where we especially think we'll see an increase is among 18 to 21-year-olds. And the reason for that, some of you, I can see you're nodding your head, so you already have an idea of the reason why, is because in New Mexico, the Cannabis Regulation Act allows anyone to be able to purchase cannabis for adult use if you are the age 21 years and older. And so we anticipate seeing an increase in those numbers between the ages of 18 and 20 because those individuals do not have the ability to purchase through the adult use system legally. Does this make sense so far? Seeing a whole bunch of head nods, so that's great. And yes, if you do have questions, please use the chat and I will address those as we continue to move forward. The next slide is about the top 3 conditions. Now, I mentioned this a little bit earlier, is that the 3 conditions we see for enrollment within the program are post-traumatic stress disorder, severe chronic pain, and cancer. So out of 28 different conditions, the vast majority of our patients who are enrolled in the program are under those 3 conditions. Now, and again, all of this data is as of the end of September of this year. So you can see that at the end of September, that half of the patients who were enrolled in the program, a little more than half, were enrolled under PTSD. And there's a few reasons behind this. One of them is that most of the conditions for the program are physical conditions, whereas PTSD is a mental health condition. So it is a lot easier for someone to go in to see a medical provider and say, I am having some symptoms of PTSD. I would like to be enrolled in the medical cannabis program. Now, I bring that on up because there was a question earlier about what some of the diagnoses may potentially have on individuals who are enrolling in the program. And I will tell you, as a medical program, we are concerned that if individuals are going to a location where they are not receiving the appropriate medical diagnosis and not receiving the appropriate medical visit, so they're not getting a full exploration of their medical conditions by the provider who is signing off on the certification, our concern then is that individual now has a diagnosis in their medical record for PTSD. And that follows them around, especially in our day and age of electronics. And so that diagnosis is going to follow them and may create potentially other issues with other treatment services, may create issues from an insurance standpoint, and just in being able to continue with their lives as if they do not have that PTSD certification and should not have that PTSD certification. So we are very concerned about that. Now, to step back for just a moment about enrollment through the counties, you can see here on this map, it actually shows how many individuals are enrolled per county. If you actually go to our program website, you actually can see this map. Each month we update it so that you can see what's happening on there, as well as we have another map that also shows percentage of individuals enrolled in the program as it relates to population in the county during the last census. So you can actually see how many individuals are enrolled within the program. Now, there are a lot of benefits for someone actually obtaining their card for the medical cannabis program. One of those, and one of the major benefits to it, is communicating with their healthcare provider. And this is something that as a program we stress a lot. Patients should be talking with their medical provider. Enrollment in the program does require that they have a medical evaluation and have the practitioner sign off stating, and this was also brought up, it is not a prescription. There is no such thing as a prescription in the United States for medical cannabis. It is not a prescription. All the provider is doing is certifying or attesting that the patient has one of the qualifying conditions and that the use of medical cannabis may be beneficial for them. So it's not saying, again, as we said before, help to alleviate symptoms. Nobody is saying that this is a cure-all, that this is going to cure their condition. Unfortunately, what we hear quite often from individuals and from people, not just within the program, but also just from general community, is, oh, medical cannabis will cure this condition. There is no evidence so far that shows that medical cannabis cures a particular condition. Now, perhaps there will be in the future, and as was mentioned, the research is getting better and better, and maybe we'll see something in the future. But at this point, we have not seen that in the scientific evidence, and that's very important to remember. And the important part about this slide is patients need to be talking with their medical providers. It also means medical providers need to be talking with their patients. We've done a survey recently and we're working on the results on it, but in that survey, one of the things that actually came out is medical providers thought, so this is a perception issue, medical providers thought that they were explaining the issues, potential negatives and benefits of medical cannabis to their patients, but the patients didn't feel as though their medical providers were talking with them about those issues. And this is among medical cannabis patients. So one of the things that we are trying to encourage is that medical providers talk more, discuss medical cannabis and its potential negative and beneficial aspects with their patients on a more regular basis, not just when they come in for an annual recertification and verification. They should be doing this at every visit they have with the patient. How many of you, when you go in to see your doctor, they go through the list of all the medications you're on? Do they talk with you about those? Medical cannabis should be treated in the same way during these visits. Now, there are a lot of reasons why that has not happened in the past. A lot of it has to do with stigma. We actually had providers, especially in the early years of the program, who would tell patients, if you're using cannabis, I'm firing you as a patient. And we have to get over those issues of stigma so that we can have real and genuine conversations and dialogue between patients and medical providers. And this includes treatment programs, having those conversations of what is working, what is not working, what are you doing? Because otherwise what we know happens is the patients or the individuals will hide what they're doing, and that could have a very negative consequences. And so when we talk about the research and the studies that have been done, these are some of the things to remember as well. How open and honest when surveys are happening are patients being about their cannabis use? And it's not that they're trying necessarily to hide things, but if they feel like there may be stigma with them answering questions, they're going to be less likely to answer them and less likely to answer them truthfully. And especially if it's their medical provider asking them. And we've had that happen on a regular basis where patients come in and say, I asked my medical provider if they would certify me. They didn't even talk about it. They just said, I won't certify anyone for the program. That's counterproductive because it means there's not an open and honest dialogue. Now, does that mean that a medical provider should automatically certify somebody for using medical cannabis if they talk with them, if the patient brings it up? Absolutely not. They should be doing the medical evaluation to make that determination. Does this make sense so far? Am I okay?
Yes.
Any questions so far?
Yeah, Dominic, this is a good point that you're bringing, like for a treatment program that has a client that is on the cannabis or the medical marijuana card, but there's issues, right? Say with the court or, and that communication, if it was a primary, without the primary healthcare, the PCP, and sending out a release of information, say, hey, we got your patient here, we'd like to get more information, but we don't tend to have access to that. And sometimes, it feels that, there's games going on or the trust of this person's on the card. And I think you kind of hit on it, but can you kind of elaborate on that exchange of information?
Sure, and that's a very important part, Lawrence. Because one of the things is, again, we talk about this not just with regard to cannabis, but with any health condition. Medical providers should be working as a team. That includes within substance use counseling, therapy, treatment programs, all of that. Everybody should be working as a team. And so getting those releases of information is very important, especially so that providers can talk with each other about what may or may not be happening. And if that's not happening at the beginning of, for example, during an intake or within the first couple of sessions, then that's really an administrative standpoint of why is that information not being gathered? Now, one of the big concerns, and this is the part that really, really comes up a lot, is again, the patient's fear that if they reveal they're a medical cannabis patient, that they will be dropped from that medical treatment or that medical provider. And so it's getting over that fear. And what I really recommend is that as a provider, that you really talk with the patient about being open and honest and making sure that they know that if they reveal this information, they're not going to be dropped. And we do talk with patients who have those kinds of conversations with their providers and who will say, I did not want to tell them anything at first, but now I've gotten to know them better and I'm talking with them about it. That helps to improve what is occurring as far as treatment. And we know that. I mean, we know that with regard to any sort of treatment. As far as the question, is there data on success rates on cannabis use for those that do benefit of cannabis? There is a lot of data, but and I'm not going to focus on studies and research because there are a lot of problems with a lot of the research that are going on right now. And one of the earlier speakers made a mention about anything that's really not from the last couple of years can be problematic because of methodology of collection, and especially because of it not really being legal on a federal level, creating a lot of barriers for research. But there are also other issues with regard to research that is done. And I'm going to get to that in a minute, but I want to make sure to get through all the slides. And I have a feeling if I talk about that right now, we may not get through some of the other information. So I'm going to put a pin on that for a moment to talk a little bit more about research issues, concerns, and problems, because there's a lot that needs to be done in that regard that we all can actually help to do. So the other benefit with regard to somebody having a medical cannabis card currently is that the medical cannabis patients do not pay their tax on medicine. So what that means is currently, if you are an adult use consumer and you were to go to a dispensary and purchase cannabis, you would be paying approximately 20% tax in New Mexico. That varies slightly based on county and municipality taxes, but it's approximately 20%. Over the next couple of years, by the way, that will be increasing because the statute, the Cannabis Regulation Act, actually provided for that to increase. So that will actually go up to approximately 26%. So another benefit of being enrolled in the program is one, well, some of the benefits, you have that interaction with a medical provider. And we hope it's a good interaction. But again, that interaction is only as good as the patient and provider relationship, right? Two, cost savings for the patients. They will not have to pay that tax on it, which is 20%. And that may not sound like a lot, but anybody have an idea about how much cannabis costs approximately per gram currently? So it fluctuates. Right now it's running about between $10 to $12 a gram, to give you an idea. And you're going to see a little graphic in a minute that'll give you an idea what a gram is, what a gram looks like. But with that, if somebody is purchasing just 5 or 6 grams, that's $50 or $60 that they're paying out of tax, out of pocket. Insurance doesn't cover this, so that's out of pocket for these individuals. Add another 20% tax on that. Many of our medical patients are in the lower socioeconomic portions of the index within the program. So many of our patients have a hard time being able to afford and pay for their medication. Now, what is an adequate supply? For the medical program, that equates to 15 ounces or 425 units every 90 days. Now, this is not a prescription, but you can consider this like a maximum amount that somebody can purchase. So it's the closest thing to a prescription that we have, but it is not a prescription. So the limit is 15 ounces in a 90-day period with no tax. Now, if a patient by chance does need more than that, they actually can purchase it through the adult use program, but they will pay tax on it. And there are other similar situations with other medications that we see, and a great example of it is ibuprofen. You can get a prescription from ibuprofen, often through a dentist when you've had dental work, and you can get that, and so purchase that without tax. Or you can actually purchase ibuprofen off the shelf, over the counter. And now somebody actually made a comment earlier also about tracking items and tracking sales. We do that. So the medical cannabis that is sold is actually tracked. There's a statewide system. And so when patients are actually, when they're making their purchases through a dispensary, they can actually track what they are purchasing, what the strengths are, and what the quantities are. And that's important from a research standpoint. Now, this should give you an idea of what half an ounce. So this image of the cannabis itself, this is bud or flower, and this is approximately half an ounce, and it is the size of a dollar bill. So what patients can buy is 30 times this image. How many of you have known what a half ounce or an ounce of cannabis looks like from a volume perspective? You don't really have to raise your hand, but thank you for those who did. So where can individuals get cannabis? So currently there are over 500 dispensaries in New Mexico. And again, the average price for dried flower product is approximately $10 per gram. That does vary a little bit from month to month and depending on how the harvests are. And the average price for derived products is approximately $16 per gram. Now, the reason we say derived products is because individuals can get oils, they can get edibles, they can have lotions, salves, different kinds of things like that. And so there's more than just an individual getting the dried flower or bud for smoking purposes. And in fact, one of the things that we do talk about with regard to Department of Health is that smoking, of course, and smoking any item is not necessarily going to be good for an individual's lungs. And so utilizing cannabis in another way may actually be very beneficial for that individual and reduce some of the potential harms that come from just smoking any substance. Patients can also gift cannabis. So any individual over 21 years of age can actually gift cannabis to another individual. So, and this of course follows the possession limit for both adult use and for medical. It cannot be exchanged for money, goods, or services. So that is a very important aspect of it. So someone can't turn around and say, here, if you give me 2 ounces worth of cannabis, I'm going to give you a bicycle. You cannot do that. So you want to make sure that individuals, if they are gifting, if they are giving to other individuals, they are staying within that limit. And then the other way people can get cannabis is through a personal grow. So under the Cannabis Regulation Act, any individual in New Mexico over the age of 21 can grow up to 6 mature plants and 6 seedlings. Now in a household, there can only be a maximum of 12 mature plants per household. So if you have 2 adults in a household, you can have up to 12 plants. If you have 4 adults in a household, you can have up to 12 plants, mature plants. So it can't ever exceed that within a household. And just so that people can see them, these are a couple of images of what cannabis plants look like. The ones that are on the left are the vegetative or non-flowering plant, and the one that's on the right is a flowering plant. Now, enrollment in the program. And here are some of the things that I think are very important, especially for providers and for people who are working in behavioral and mental health fields, for you to hear about this, because there's a lot of misinformation out there. And while the information is very clear on our website, while this information is in statute and regulation, we still hear from a lot of people that it gets misrepresented to them. And so the first one is that the medical cannabis program itself, we have no fees. We do not collect any fees. Some of what will happen is the patient will say, well, it was really expensive to get in the program. And that is whatever fee their provider may be charging them. And this is another reason, by the way, why a patient, it's beneficial for them to go see their primary care provider, because they can go and see a primary care provider during their annual physical, during another office visit. And then that provider, if they agree, can then certify that individual. There is no need for an extra fee or an office visit to another individual. However, within the industry, there has been this push that, oh, a patient, if they're going to enroll in the program, they must go to somebody who's a specialist in regard to cannabis. And so they're going to other providers, and that is not necessarily what the program was designed to do. The program was designed to be done in conjunction with the primary care provider or someone who's already on that patient's medical provider team. So the processing times may vary a little bit. It has to be by statute within 30 days. It is usually much faster. I think right now, and we also have a clock up on our website that tells people what date we are working on applications. And that's usually within about 2 weeks these days. And so people can just go to our website, and the link is here in the video, and someone can actually just go there and see how quickly that their application will be processed at that time. The online patient portal that we have, and I'll show you all that in a moment, is a faster process than a paper application. It is a new process. So we do recommend that if people are doing that, and they do run into any issues, that they contact the program right away so that we can help to alleviate any potential issues. And patients must submit a valid New Mexico ID with their application to show that they are indeed a resident of New Mexico. Now, the card does not expire for 3 years, and it requires an annual medical verification. So every year, the individual does need to see their medical provider to maintain good standing in the program. Now, there are some exceptions to that during COVID, where that was not being enforced because people were not able to go in and see their medical providers. We also did some extensions on individuals' expiration dates during that time, again, to try to ensure patients could be as safe as possible. And this next point, I cannot emphasize it enough. The medical provider must evaluate and certify that the patient has one of the qualifying conditions. The evaluation is the most important aspect. And some people have brought up today about, is this something that medical providers are doing? Well, here's my answer. I think a medical provider should be evaluating their patient anytime they're having an interaction with their patient. So if they're not doing that, that medical provider is not following what they are supposed to be doing. And those patients should then be taking it to the respective boards if they are not getting the medical evaluations that they should be getting. And again, if you're going in and you're paying a medical provider on your own for a medical evaluation, would you not want them to do an evaluation to the best of the ability? It's very important that people do this. And as you've heard earlier, there are potentially some negative consequences for medical cannabis. And so one of the big things with regard to this is that those medical evaluations need to be detailed regarding that specific condition that the patient is presenting with. Oh, and we do have a question in the chat. Let me just check on this. So the question is, one barrier to partnering with a provider is the healthcare system or department does not allow providers to fill out the form or make a recommendation. Because of this, patients have to seek a cannabis specialist. The main reason is fear of losing federal funding. Is this true? Unfortunately, it is true. And this has been an issue since the beginning of the program. So especially hospital systems such as the VA, so the Veterans Authority, or IHS, their providers are federally funded. They're in federal positions. And because cannabis is still illegal on a federal level, then they are not able to certify individuals for the program. But that is based upon the federal side of it, not based upon what the state of New Mexico has said. Now, as far as other hospital systems, quite frankly, that goes back and forth. And we hear from providers within the same hospital system. Some will say, yes, I can certify people, and they do on a regular basis. And other providers say they don't, and that they can't, and they've been told they can't. So that is something within the systems. But if you have a particular healthcare system that is not allowing it, we also recommend please reach out to us in the program. We are happy to do some education. We can't promise that they will change it, but we are happy to do that education and to try to work with them. And so one of the other things that's important is telemedicine can also be utilized. So this is something, again, with regard to patients who may be immunocompromised and who may have concerns with going out, especially during times when there is an outbreak of other potential infectious diseases. This is a way to stay in communication and in touch with the patients and the providers, and to be able to still provide the services necessary. And then again, well, I can say it on a regular basis, but the providers are certifying the patient has the condition. They are not prescribing cannabis. Now, caregivers are also, and I'm not going to go into detail on the caregivers, but essentially a caregiver is for the situation when either there is a minor, a hospice patient, or somebody who needs additional assistance. And a caregiver essentially is assigned and is enrolled in the program so they can purchase cannabis for that individual, so that we do not run into a situation, for example, of saying to a hospice patient that they have to go to a dispensary to buy the cannabis that helps ease their pain. And so that is really what a caregiver is for, really pretty much what it sounds like. And this is just an example of our current cards. We are getting ready to launch a new format on our cards, so I'll show you that here in just a moment. But this is what our current cards look like. You can see that they do actually have the recertification dates on here. They do also have the expiration date in the bottom right-hand corner. But again, as we know from many other things, how many of you have looked at your driver's license for the expiration date recently? Do you know when your driver's license expires? Same thing happens with regard to these cards, unfortunately. And then this is a sample of what the upcoming cards will look like. They are a little bit simpler in some ways. They combine the information together a little bit better. The top image is the front of the card, the bottom image is the back of the card. And as you can see, as we continue to move along, we even have a QR code that actually brings people to the website so they can get additional information. Now, there's one other aspect of the medical program with regard to types of people who can participate, and this is reciprocity. And so reciprocity is for out-of-state individuals, so people who are not New Mexico residents who would like to participate in the program. Now, this is the one time where the individual is registering at the dispensary. So the reciprocal participant simply has to show proof that they are authorized to participate in another medical cannabis program. So for example, the one in Colorado, and then show a photo identification that they reside in that same locale. So they can't be enrolled in a program in Colorado and show a photo ID issued by the state of New Jersey, or vice versa. It has to be from the same locale. And then they register electronically at the dispensary, and once they're registered and it's confirmed by the program, it is valid at all dispensaries. And they have the same rights otherwise as any medical patient in New Mexico. And I mentioned that we have the online patient portal, and this is something that we launched this last year. This is a great way for medical providers to be able to track all of the information that they're entering in one place. Oh, and I'm sorry, there was a question in the chat from Miranda. Miranda, yes, that is correct. If it is more than 90 days, a new application should be completed. The signatures are good for 90 days from a medical provider. So great question. Thank you for asking. But anyway, the patient portal is a great place for the medical provider. Once they register on it, they are then able to provide the certifications electronically for the patient. The patient is able to also log in and track their progress for their application and for a few other items. So this is especially helpful for providers who are engaging in telemedicine with their patients. So they can go ahead and utilize this. They can submit their medical notes electronically, their signature, everything through that process. And some of the key benefits on this is especially for patients who are in rural communities who are not, if they go through this process, they don't need to drive 60, 80, 100 or more miles to go see their medical provider. This is also beneficial for any individual who has an issue with being able to get out and about, including hospice patients, or for example, as we saw during the COVID-19 pandemic. It's also a much more secure method to complete enrollment and reduces time in exchanging paperwork or mailing the paperwork. One of the issues, of course, with going through a paper application, especially say, for example, somebody who lives in Las Cruces, our office is in Santa Fe, it needs to be mailed. How often is there an issue or a problem potentially with the mail? The added days of both it being mailed in or being mailed back out to the patient or to the provider. So if it's done through this online portal, we're able to help correct information a lot quicker. There's not the back and forth that needs to happen on a paper basis because it can all be done electronically. And just a couple of features within it. We were mentioning before that the patient can access their sales, so they can see their last 90 days of their sales that they have, so they can track. This can be very important for a patient trying to determine what strain of cannabis is actually beneficial for them and what is not working so well, or what type. So for example, is somebody having better, are they experiencing a better effect if they're eating something, an edible, versus utilizing it in a different way? There also is a digital card that's available through this site, and we're actually releasing that at this point, where individuals can actually use the electronic card. So if they've lost their card, they'll be able to use it. We're looking at getting that information actually out to the dispensaries in the next couple of weeks so that patients will be able to utilize it. But the function is actually already within the system. And again, like I said, this has the ability for individuals to look up their sales history. And this is an example of what that sales history, my apologies. What happens sometimes when you're on electronic means and accidentally hit the touchpad too quickly. It suddenly scoots you ahead 10 slides. But this is an example of a sales report where somebody went into a dispensary. It shows their dates, the times, and what they actually purchased, so that someone can go back and look and see what they have done. Where I actually find that to be very interesting is if, especially from a research standpoint, if the appropriate release of informations are obtained, then we could be looking at that to see, are there differences? For example, in somebody who is treating PTSD, in the different products and the different strains. I think it was Dr. Gonzalez who talked a little bit about the different strains, where you have sativa, which tends to be an uplifting or energizing strain, versus indica, which is a relaxing or more calming strain, where you may have a patient who has PTSD and the sativa strains, the energizing strains, may actually not be beneficial for them, but an indica may be. And if somebody doesn't have a way to track that, there's no real good way for them to know what may be working and what may potentially be exacerbating some of the negative side effects. And so this is something that we think would be really great for research down the road, because we'll be able to see better what is actually being utilized and what is working versus what is not working. And then here's just an example of the card and how it shows on a digital aspect on it. So one of the other things that was mentioned earlier is about educational materials. We actually have a lot of educational materials on our program website. And so I invite people to go to our website to see them. One of them is this quick guide of medical versus commercial or adult use cannabis, where it goes through all of the information, everything from age limit, usage in public, purchase limits, reciprocal packaging, and really making sure that people understand and know what they would be able to do to keep themselves protected from a legal standpoint with regard to cannabis. For example, one of the biggest things that we keep hearing from individuals, and by the way, one of the things that we actually do is we have a 24/7 law enforcement line. So if someone is stopped by law enforcement, they are able to contact the program to verify enrollment. And also if they have questions about limits or things like that, we can help answer those questions for those officers. One of the big things that we keep getting the question is individuals say, well, I went and I bought some cannabis and I went out of state and I got arrested out of state, but I thought I was protected because I was in the medical program. And the answer is no, they are not. And the reason for that is because you still cannot cross state lines with cannabis. And so especially if someone, for example, purchases in Las Cruces and drives over to El Paso, if they get stopped by a Texas state trooper, for example, they have cannabis on them, that is not legal for them to do, even if they bought it in New Mexico, and even if they are in the Texas medical program, because they drove across state lines. And so that is one of the things that we really try to ensure that people understand. And the same is true between programs, even if it's another legal use state, such as Colorado, you still cannot cross that state border. Crossing that state border is still federally illegal. In addition, one of the other things we have in New Mexico is the Border Patrol checkpoints. Those are federal, and again, it is illegal to bring them through those federal checkpoints. That can create an issue for somebody, for example, who needs to purchase cannabis in the southern portion of the state and then go to the northern part of the state. And so individuals do need to figure all of that out. And there are a couple of questions in the chat. Let me just catch up on those really quickly. So the one question is, do we think that cannabis will ever get legalized federally? I really can't answer that. That's all about the politics. And as we all know, politics go back and forth many different ways. And so we'll see what happens. But what I can say is New Mexico did not used to have a medical program. New Mexico did not used to have recreational sales or adult use sales. And we now have both of those. So do I think that it will happen eventually? I think there's a good likelihood. But when and where exactly, I couldn't answer that. And as far as a person on medical cannabis be exempt from it showing up on a work drug screen, that actually depends upon the employer. The department and the program doesn't have any control with regard to that. Now, there are some protections for medical cannabis patients, so long as they are not in a safety sensitive position. But there is a lot of debate about what exactly is a safety sensitive position. And essentially that means that if being under the influence in any way might potentially create a problem, a safety problem for that individual or for others, then it gets excluded. So there's still a lot of work being done legally with regard to that. And as far as what is needed before cannabis could be legalized, again, that's a political question, and it really depends on who is in office at various times on the federal side. And then as far as a client asked if they had a medical card, could they be excluded from apartments with no drug policies? Again, this comes down to the same issue with regard to the work aspect. By itself, having a medical card would not exclude an individual or cannot exclude an individual from housing and from other aspects of life. And then how many plants can be grown now that legalized? So the plants, again, it's adults 21 and older can have 6 mature plants and 6 seedlings, no more than 12 mature plants within a household. And then does the NCIC show law enforcement that an individual has a medical marijuana card? No, it does not, at least not with regard to New Mexico. I can't answer for other states, but that is actually why we have that 24-hour line for program or for law enforcement officers within New Mexico. And the main reason for that is to help keep patients safe and to ensure that if they are following the legal guidelines, that they are not getting arrested for something that they're doing legally. I hope that answers the question so far. Okay, great. So just a couple of other things. Again, the highlights: a person must be 21 years or older to purchase adult use. People can be any age to be enrolled in the medical program, but if they are under the age of 18, they do have to have a caregiver also. Adult use consumers are paying approximately 20% tax for every purchase. And the possession is a little bit different for adult use. Individuals who are purchasing for adult use cannot purchase more than 2 ounces, 16 grams of concentrate, or 800 milligrams of edibles at any one time. However, I want to note that does not mean that an individual cannot make multiple purchases in one day. Now, they cannot possess that on themselves more than these limits. However, what they can do is they can always store them in a private residence and purchase more. So that is one aspect of the adult use statute. So is it safe? So you've heard a lot today about potential negative effects, and I'm not actually going to say anything about those being true or untrue, other than the fact that we need a lot more research. A lot of the research we have that has been conducted over the last several years has had extreme barriers. And I mentioned a little bit about variety within the product. Is it actually working? You know, you wouldn't turn around and say to someone, here's an opioid, I'd like you to try on your own different strengths and different varieties just to see what works, right? But unfortunately, due to the political and the way things have happened legally, that's essentially what we've done with regard to cannabis. So we need more research looking at specific strains, looking at specific concentrations, looking at specific delivery methods. So is it smoked? Is it vaped? Is it eaten? Is it applied topically? We need a lot more research in all of these areas before we can start definitively saying this is beneficial, this is a negative, has a negative effect. Because right now, the reality is we don't know. We are getting some better research as things do improve, and especially as was mentioned from some other countries, especially Israel, and that is very helpful. But some of the things that we do know is that it does have an extraordinarily high lethal dose. So as you can see here, you would have to smoke approximately 1,500 pounds of cannabis in 15 minutes. So, but then the other question is the absence of mortality with THC may simply be a result of the low density of cannabinoid receptors in the brainstem. So we may not see it because those receptors do not actually contain that much THC at any given time. Increasing potencies, that raises a lot of concerns, especially from a medical perspective, about overall safety. To give you an idea, in 1995, it was approximately 4%. Now it is approximately 31%. And then additional items such as DAB, which is a specific method of utilizing or a specific product where the cannabis is distilled into a liquid in wax form. But THCA crystalline claims 99.9% THC concentration. So there are concerns about this. We would have concerns about any medication that increases its potency like this. Because like anything else, any medication can be used appropriately and any medication can be misused. So we want to ensure people are using it correctly. So a few items of caution: delta H THC, which was mentioned again earlier today. It is unregulated. It is often misrepresented as a non-psychoactive hemp. It has unpredictable response when people are using it. And the way it is extracted, there are potential dangers from things, the solvents and the chemicals that are used to extract it. And so there are definite potential health concerns in those areas, especially among people who may already have compromised health conditions or immunosuppressed. And then synthetic cannabinoids, I'm sure you've all heard, spice, K2, there's several others, but they have a greater binding affinity for the CB1 and CB2 receptors. It's very difficult to be able to detect it with current drug testing. And there are new analogs continuously synthesized. This is something that there have been statutes and laws outlawing various chemical properties for these various types of cannabinoids, synthetic ones. However, they continue to pop up. As soon as one is made illegal, a new one will appear. And then we've gotten a lot of questions over the years, especially with regard to tribal communities. And really, in a nutshell, is for the tribal communities, especially in New Mexico, this is really up to those tribal communities to determine what they would like to do. If they would like to have a medical program or to allow, it is up to them. And what we recommend is we recommend that individuals in tribal communities reach out to their tribal leaders and talk with them about it. There have been several which have actually had or started their own programs and others which do not allow at all. But that is something that they really need to discuss internally and ensure that the people living on tribal lands, if they have questions about it, they reach out to their own tribal leaders. And then cannabis and firearms. This is also another big thing that comes up on a regular basis. And New Mexico does not have a specific barrier to individuals utilizing cannabis as a medicine and owning or possessing firearms. However, the federal government does. And there are federal restrictions. And I do have the list here for the ATF and for what they have actually stated as their position for medical cannabis. And we recommend that individuals check with them. But currently, it really is that if somebody is utilizing medical cannabis, it does not protect them with regard to federal firearms. Federally, they still say you cannot have federal firearms and using cannabis as a substance. But the enrollment in the New Mexico program, that is not a permission for someone to simply violate federal firearm law. You know, some people will think that, oh, I'm enrolled in the program, therefore I'm protected. That is not the case. And this is often not explained to patients, that they need to understand this. And they find out after the fact, and then quite frankly, they freak out. That's not fair to them. That needs to be addressed when someone enrolls. By the way, that is on our website, multiple places about it. But again, it's about necessarily getting people to go there. So this last slide is really, again, this is our patient guide, or one side of our patient guide. There's actually a lot more information, as I mentioned, and it shows our website where people can actually access this. Now, there's quite a lot more on our website. It includes things about safe storage, which was brought up earlier today, edibles, product labels, making sure that people know what they're putting into their bodies. And it has information about safer methods of use, cannabis during pregnancy, cannabis use during pregnancy and breastfeeding, cannabis and pets, and several others. So I really welcome everybody to go utilize it. You're welcome to take those, copy them, download them, copy them, link to them, especially with regard to patients. We really encourage people to be able to really be able to get the information out there, because the unfortunate part is there is a lot that is out there that is misinformation. And I will tell you, we are on a regular basis, we are combating that misinformation, that somebody was told by their brother's friend, cousin's medical provider that it was okay to do this. And we go, whoa, that's not actually the case. So anytime people have questions, we refer them to our website, but you're also welcome to call us directly. We are more than happy to answer those questions. And I do see I'm out of time, except for the question period. So I'll just go here to the questions. Actually, I'll go ahead to the more information for anybody who needs to take down the email or our website or phone number. But in the meantime, are there additional questions?
Thank you, Dominick. What an excellent presentation. Thank you for some clarification as well. Just a couple, if somebody got a DUI, driving under the influence, and one or twice, does that mean that they're not in good standing and they can lose their medical marijuana card?
No, so DUIs do not actually influence somebody's enrollment in the program. If somebody is actually in the program and they're doing it from a medical perspective, those do not make a difference on it. Now, with that in mind, a medical provider can, although it doesn't happen very often, but a medical provider can rescind their recommendation.
Got it. And and as mentioned earlier, what is your knowledge of understanding the taxes of 20% for cannabis sales? And just like alcohol, liquor excise tax, or when the casinos came into New Mexico, there was a percentage for treatment. What is your, according to some of our legislators, it's not clear on treatment in terms is that true?
So Lawrence, I'm really glad you asked that question, because this is an area that there's been a lot of misunderstanding and confusion. Currently, those taxes that are gained, other than the ones that are specific for the municipalities and the counties, so they're local taxes, but the ones that are from the state, those actually end up going into the cannabis fund, which actually turns into state general funds. And that will then be allocated by the legislature into specific programs. Now, part of the reason there's some confusion about it is one of the earlier versions of the bill that finally became the Cannabis Regulation Act last year. One of those earlier versions actually included specific set-asides for county and for the Department of Health to do programs about substance use treatment and education regarding cannabis. Those were not in the final bill. And so how that money will get allocated will be up to the state legislature. So your comments earlier about if you have questions about that, concerns about it, wanting to ensure that, again, speak to your state legislators.
Excellent.
Oh, John has a good question in the chat. Is a prescriber that recommends medical cannabis risking a prescriber medical license? The answer to that is no, because they are not prescribing it, and all they are recommending is that the individual has this condition. That's all they're certifying, and that cannabis may be useful. Then they are not at risk for losing their license.
Excellent. Any other questions? And again, oh, here we go.
As far as the doctor not collaborating, unfortunately, I don't have a particular fix to that other than trying to establish a relationship with that particular provider, especially if it's a provider who is registering or who is certifying individuals on a regular basis, and really trying to do that. But if it becomes a treatment issue and that provider is not cooperating with regard to treatment, and the patient has provided the necessarily releases of information and permissions to be able to collaborate with them, that would actually be something to go before that particular board. By the way, Sylvia, since you asked that question, just in general, we encourage providers, as you've heard me say, we encourage providers to work with each other with regard to this. The last thing that, that we really want patients to experience is not having that collaboration among their healthcare providers, because we all know that when that occurs, or when there is a lack of collaboration, there are worse outcomes for those patients.
Excellent. Any more questions? Here we go. And of course, Dominick's contact information is in the chat. Here we go, Mr. John.
Yes, John, there are possibilities when people are, for example, arrested for distribution of cannabis. It has not been, oh, I'm sorry, for everybody who can't see the chat, the question is any sanctions or penalties when a card is abused. And what that really comes down to is somebody has to be convicted of a legal crime with regard to it, specific to the cannabis, and that actually can happen and has happened in the past. Where, for example, somebody has been convicted of distribution, especially in cases like distribution to a minor, things like that, that individual can then be disenrolled and barred from the program.
All righty. We're winding down, and this is good for some that we're basically a half hour ahead of time. Amanda, any thoughts that you want to share on this presentation?
No, thank you, Dr. Zurlo, for presenting and covering all the specifics in our state. I think there's a lot of myths that I hear out there amongst clinicians and patients. And so it's just wonderful to hear all of the actual realities of the legalities of the program. So thank you.
You're very welcome. Thank you. And again, thank you for having me here. There is one more question that just showed up in the chat. And if you're okay, I'll go ahead and answer.
Go for it.
Okay. So the question is, are there compliance checks out there for dispensaries? So when the Cannabis Regulation Act was passed, the license and compliance section of our program actually moved over to the Regulation and Licensing Department. And so now under a new Cannabis Control Division, and they actually are in charge of those compliances. And I can tell you they have been going out doing compliance visits on a regular basis. And in fact, if you go and look in the newspaper, you'll actually see some where they have been citing some of the dispensaries for not doing the things they're supposed to be doing. So that is happening.
Excellent. Any other questions before we say our closing comments? Dominick, again, thank you for your time. This has been very informative, and as we continue, we encourage the Department of Health and your excellent presentation and information to continue to hit the road to inform communities. And again, not to minimize the positives of cannabis, but let us not, not address cannabis use disorder, as saying 10% dealing with alcohol. What do we see cannabis in 5 years with addiction, and that continue to contribute to the problems that we're faced with in the state of New Mexico. So, you are kind of our gatekeeper, so we are grateful. Let's see here. There's maybe another question from Jay. Do you see that, Dominick?
I do. So the question is, will RLD take all fines and user revenue to run their program? I can't answer specifically as far as from the fines, but they do. Their funding does come from the licensing, and I would anticipate that will include any monies from fines with regard to that. And I know that they are trying and working on expanding what they are doing with regard to compliance, including some of the safety issues and safety regulations, like testing of product and really making sure that the products are as safe as possible. But one thing to realize is this is all, while we've had a medical program for many years, it was a much smaller program. And so as any industry is growing, it takes time to build up the infrastructure. And so a lot of that is occurring, but it is happening. And it has really been great to see the efforts and the progress that has been being made.
Thank you. And one of my colleagues is a drug and alcohol counselor, stated was there information from today in your presentation to take back to the organization. Some of the things that, yes, that we have this video that we could have other staff that was not able to make it. So we encourage your teammates that wasn't able to participate today to go to HUVA for 3 months. It'll be posted, or the Rio Grande ATP YouTube page. There's other things that we've seen, cannabis use disorder curriculum for groups, for say IOP or residential, that Mary was the question that will forward that cannabis use disorder treatment curriculum to see if we could purchase that with the videos. So this has been really good. Again, the video, we got the CEUs for you all, will be distributed through HUVA. That's going to be the place of communication. We'll do our best. HUVA was a big learning curve for us. It's a big machine that we like, but the learning curve was a little bit, as you knew, some of you getting in, but we're hoping that that platform could be a way to a step up from the Chipmunk or Monk, the other communication platforms that are out there. So, and again, to all our speakers, we thank you for your time. We also, again, thanking the Behavioral Health Service Division for sponsoring this event under the individual peer review committee. There's 9 committee members that we put this together. We put a lot of time. We were meeting every Wednesday. Want to just reach out to the committee members who agreed to this endeavor that I felt is successful, that we wanted to achieve, and we achieved it. And I guess if anything else, we're good to go, Amanda?
Yes, thank you all again, everyone, for attending.
All righty, folks. Well, hope you have a wonderful day. And that concludes this workshop on cannabis use here in New Mexico. Thank you.